Phos-Duse 3 definition of dry eye disease centers on two primary mechanisms: a loss of homeostasis resulting in tear film instability and ocular surface inflammation. In this tutorial, you will master two clinical objectives: establishing an objective diagnosis of Meibomian gland dysfunction and physically treating that dysfunction using BlephEx eyelid debridement. Before you begin the physical exam, you must complete the patient's symptom history. Using a standardized questionnaire like the OSDI-12 provides a necessary subjective baseline to evaluate against your physical findings. You will need three specific items to execute this procedure: the handheld Meibomian gland evaluator, a prepared BlephEx treatment kit, and topical anesthetic drops. Capturing a standardized diagnostic baseline is clinically useless on its own. To provide actual relief, that diagnosis must immediately trigger a consistent, targeted physical treatment protocol. Step 1 is the physical evaluation. Begin by bringing the handheld Meibomian gland evaluator close to the patient's lower eyelid margin. Position the device just below the lash line and gently depress the lower eyelid to evaluate the Meibomian gland secretions. Watch the tool's shaft closely. Only push until the white depressor reaches the first mechanical stop. Pressing beyond this applies excessive pressure, artificially inflating the expression rate and ruining your standardized diagnostic baseline. Next, we move to the objective scoring methodology. You will evaluate the quality of the Meibomian secretions across a total of 15 specific glands per eye. This diagram maps those 15 glands. Divide the margin into 3 zones: 5 temporal, 5 central, and 5 nasal. Add the values. A combined score of 12 or less in either eye definitively indicates Meibomian gland dysfunction. Relying on this rigid numerical threshold removes subjective guesswork from your diagnosis. A score of 12 or below provides a definitive trigger to initiate physical eyelid debridement. Moving into the treatment phase, start the patient staging process by instilling topical anesthetic drops into both of the patient's eyes. This must be done before handling the device. Next, prepare the BlephEx charging base. Swab the lid of the base with alcohol and let it dry. Then pump the cleanser foam into the reservoir and place your treatment tips inside to soak. Remove a fully soaked microsponge tip from the reservoir and attach it securely to the end of the BlephEx handpiece. Pay close attention to this safety warning. Before turning the unit on, point the device completely away from the patient. Then press and hold the power button for 2 seconds to start the rotation. The spinning sponge and throw off excess cleanser upon startup. Strictly adhering to this directional startup protocol prevents accidental chemical spatter in the patient's eyes. Have the patient lean back and look up. Use your non-dominant hand to gently pull the lower eyelid downward, securing it firmly in place. Apply the spinning microsponge directly to the lower lash line. Notice how the rotation actively clears away the scurf, dead skin, and accumulated debris. The most common error clinicians make here is being too gentle. You must apply firm pressure across the entire width of the lid margin. While it seems counterintuitive, firm pressure is actually more comfortable for the patient than a light tickling sensation, and it allows the sponge to effectively mechanically latch onto and lift accumulated scurf. Maintain this firm back-and-forth motion continuously for a full 20 to 30 seconds. Ensure the sponge reaches all the way back to the Meibomian glands. Pause at the midpoint of the treatment. Press the power button once to reverse the microsponge's direction of spin. Verify the direction change by confirming that the R LED is lit on the handpiece. Then repeat the 20 to 30 second treatment pass on the exact same lower lid. To adapt this protocol for the upper lid, instruct the patient to look down. Gently pull the upper lid upward and repeat the dual direction passes along the upper margin. Combining firm physical pressure with bidirectional spinning clears the lid margin of debris, removing the physical obstructions that block Meibomian gland expression. Following this procedure, you have achieved 2 immediate clinical results. The patient now possesses an objectively scored glandular baseline and a completely debrided lash line. This visual comparison proves the efficacy of the BlephEx treatment. On the left is the obstructed margin prior to treatment. On the right, the newly cleared, stimulated lash line allows the Meibomian glands to function without physical barriers. From here, establish an escalation protocol. If chronic cystic conditions or severe symptoms persist after this physical cleaning, advanced interventions are required. For non-responsive patients, your next technological steps include detailed infrared meibography imaging to assess structural dropout, or targeted localized heat therapies like LipiFlow. Securing objective diagnostic metrics and executing a thorough physical debridement resolves immediate physical blockages. These procedures establish the clinical baseline necessary to manage ocular surface disease according to international standards.